Heart disease and cancer, the top two causes of death in the United States. Each one alone stands as a health crisis, but many reports show a link between these two killers, and that has healthcare workers very concerned. RodSTARNS takes a look at this issue and what oncologists are doing to protect their cancer patients from heart disease.
A rainy day for a walk, but Debbie Roberts and her husband Joe don't mind. A stroll through a few raindrops doesn't even compare to the dark clouds they've had to endure. The drama in their personal lives started back in 2002 when, after a routine mammogram, Debbie heard the one word she never wanted to hear.
It was cancer. Shock was the first thing, and then you just hear the C word, or I did, and you just start thinking, bad things.
Debbie had a mastectomy, followed by 6 months of chemotherapy. She was even nearing the 5-year survival mark, the period of time in which studies show cancer patients have a good chance of remaining cancer-free. That was when the dark clouds returned.
We did biopsies at that time and found that her cancer, in fact, had reestablished itself.
For patients like Debbie, the diagnosis of cancer can be devastating, and treatment can take a physical and mental toll, more so than you might realize. You see, the frustrating aspect for physicians and patients alike is that in the battle to eliminate one potentially fatal disease, cancer, you might be triggering another, heart disease.
When you're ill, and cancer can make you ill and feel weak, that always affects the rest of your body, your heart as well. But the real link that we worry about most in oncology is the link between chemotherapy and damage to the heart. Because some of the chemotherapeutic agents can damage the heart at the same time they're fighting the cancer. Now, to balance that out, when I talk about potentially cardiotoxic drugs, I'm talking in the 1 to 2 to 3% range. These are not drugs that automatically cause heart toxicity, or else we wouldn't use them at all. So what we do is we use different cardiac evaluations while we're giving the chemo to make sure that the heart's okay. Echocardiogram is the one we use most frequently because that gives us a great evaluation of how the heart's pumping and how the heart is functioning.
High dosage of certain medications can also increase the risk of heart problems, so physicians closely monitor heart test results as the dosage of chemo medication is increased. One other possible link between cancer and heart disease is really a domino effect that doesn't often occur to patients. Chemotherapy can lead to fatigue, and when you're tired, the last thing you want to do is exercise. And a lack of exercise can lead to weight gain, and that can be bad news for your heart.
It's really tough. You don't want them to go out and try to run a marathon because then they feel terrible for the next 3 days. So what I usually focus on is I focus on time rather than distance. And I'll say, okay, I know you're tired, walk 5 minutes. Do that for 2 days, and then 2 days later, walk 7 minutes. 2 days later, walk 9 minutes. Because what we really need is 30 to 35 minutes of cardio exercise. We need the heart rate to get up, so we try to build up that way.
And I knew that I had to do it health-wise. It's something you just have to do, and sometimes you have to push yourself.
As with most cancer survivors, Debbie's become accustomed to pushing herself. Pushing through the pain, pushing through the stress, pushing through disappointment. With the help of family, friends, and some very attentive healthcare workers, she keeps on pushing, battling one disease while keeping a close watch that another one doesn't develop.
She's doing great right now, and as long as the chemotherapy works, she'll continue to do great. Right now it's in complete control, and we don't think that she has any active cancer right now at all. But we know that it could start up again at any time, and so we have to monitor it carefully. So that cloud's always going to be over her shoulder. She's always going to have to think about breast cancer. But right now she's doing great, and it's an incredible blessing.
I feel good. Some days I'm stronger than others, but I'm still working. I get to, be with the kids, what I love. I feel very blessed.
For Smart Medicine, I'm Rod Starnes.
Joining us now is cardiologist Stacy Smith. Dr. Smith, welcome to Smart Medicine.
Thank you. Nice to be here.
It's a pleasure to have you. Why are breast cancer survivors at risk for heart disease?
There are 2 reasons. First, the treatments that are given to patients who have breast cancer can cause damage to the heart muscle. And if it's detected early, usually by echocardiograms, then that can be stopped with medications in order to allow the patient's oncologist to go ahead and give them the optimal therapy to get treatment. The second reason is that women are actually surviving long enough now from their breast cancer to develop the standard risks for heart disease. So that would be high blood pressure, high cholesterol, and diabetes. And left untreated, those can progress on to heart disease.
What can breast cancer survivors do to decrease their risk for this problem?
Simple things like getting their blood pressure checked, having their blood glucose checked to be sure they don't have diabetes, having their cholesterol checked. Of course, not smoking, that's very important. And probably the two most simple, important things are to have a good diet and have good exercise habits.
And are signs and symptoms of heart disease in breast cancer patients different?
Yes, signs and symptoms of heart disease in women in general are different. Women tend to more often have shortness of breath with exertion or stress as opposed to chest discomfort. They can have discomfort, not really pain, just discomfort in their neck, their jaw, their back, their arms, or they can even feel like they're having indigestion. So many times those symptoms are different in women compared to men.
All right. Dr. Stacy Smith, thanks so much for joining us today.
It's a pleasure. Thank you.
Be sure to stick around because later in the show, we'll tell you how heart attack symptoms differ between men and women. As always, if you want to learn more about any topic you see on Smart Medicine, head over to WKNO.org and click on the Smart Medicine icon, or check out smartmedicine.tv.